New federal rules are set to get into effect next week in Maine and across the country that will make a life-saving drug more accessible for those in recovery.
Under the relaxed rules, patients can take an opioid use disorder drug at home for 28 days rather than having to travel to a designated clinic. Supporters say removing barriers to methadone is long overdue. News Center Maine's Vivian Lee explains.
Joshua Wentworth is a peer recovery coach and the house manager for the Courage House, a transition living program for men in recovery. Joshua says the program and medication-assisted therapy, methadone, has been nothing short of life-changing.
It's allowed me to, get back with my family, have a professional job.
Before the pandemic, strict regulations required methadone patients to line up at a designated clinic daily as early as 5 o'clock to sip their daily dose of liquid medicine while being watched. During COVID, patients were allowed to take methadone at home, and research found that overdoses didn't increase and people stayed in treatment longer. Joshua can take home medication every 13 days, but he says getting it at a clinic is still a hassle.
Waiting in line for long periods of time. Doesn't matter what time you go there, the parking lot's always full, there's always people waiting.
On October 2nd, Maine's 15 methadone clinics will have to comply with new federal rules, allowing stable patients to take home 28 days worth of methadone. Tom Doherty is the executive director of Milestone Recovery, which helps refer patients to methadone clinics. He says the relaxed regulations send a powerful message.
It's definitely a compassionate way to say to people, we trust you, and here's how we're going to trust you.
Dr. Bobby Makamala is the president-elect of the American Medical Association and chairs a task force on substance use and pain care.
When you need an antibiotic, you don't need to go somewhere and get that antibiotic and have somebody watch you take it. And in the same way, to sort of treat substance use disorder and destigmatize it is something that is very welcome.
For Ryan Page, methadone was not a good option because he didn't have reliable transportation to get to and from a clinic.
Access Direct, trying.
Now in recovery, he and his wife Cynthia run Access Direct Recovery Network, a nonprofit that connects people to a network of resources from residential treatment beds to self-help meetings.
Having something that people can connect to when they're ready to connect to it without as many barriers as possible is always going to be beneficial.
As part of National Recovery Month, this Monday, the nonprofit is holding a softball game and barbecue to celebrate the gains made by those in recovery from substance use disorder and changes that put patients at the center of potentially life-saving care. Vivian Lee, News Center, Maine.